Well, hi, I'm Lori, and I just want to share my experience with you, which has been I started feeling really tired and low energy. I wasn't able to sleep. I had muscle cramps. I had like a list of things, and I would go. And still, I was gaining weight. My hair was falling out. I had skin problems. I had all these problems. I couldn't sleep at night, so I figured that's why I needed to take a nap in the afternoon. My fingers were freezing. My fingers and my toes freeze at night. I wear a sweater in the summertime. I live in Florida. It's 90 degrees, and I'm wearing a sweater. I would go to the doctor, and I would tell them, and they would do blood work, and they would tell me, oh, you're not exercising enough, or you're not eating right, or you're not this, or you're not that. So I started doing, I do all those things. I would exercise, and I would eat right, and finally I bugged my one doctor enough, my gynecologist, to send me to someone who tested my levels twice in a 2-week period of time, because she said the levels go up and down, which made total sense to me. And she said, yes, you're off, your thyroid's off. She sent me to a specialist who put me on Synthroid, a medication, and I started to feel a little bit better. But I still couldn't lose the weight, and I was still tired. I was better, but I still had all the symptoms, and they weren't going away. And and I work out a lot. I'm in martial arts. I'm a second-degree black belt. I worked out. I was running a school, and I was working out 5 hours a night, and I still couldn't lose the weight. Eating right, I still couldn't sleep. I was, and everybody kept saying, "Well, you're just getting older." That I thought, "Oh, this is getting old." They're right. It's horrible. But I thought there has to be more, because I'm doing all the right things. So I continued to go back to the doctor, and they thought, well, we need to increase your Synthroid. They increased my Synthroid, and I still didn't feel that much better. I'm falling asleep at the wheel, literally when I'm driving the car at 2 o'clock in the afternoon. I would have to take naps in the afternoon. I would have, my husband's like, what is wrong with you? And it's just ridiculous. And, it was just so frustrating to do all the right things and still not get the results and still not feel well. And just to come to the realization that this medicine is not working for me, there has to be something else. So I came to Dr. Carlson, and we've talked about the levels. We looked at my lab work, and they just weren't hitting everything that they're supposed to hit. And he found the problem. And so, I'm just really excited that there's a solution. Thanks.
This patient is a prime example of the failure of conventional medicine and endocrinology to carefully identify the true problems with hypothyroidism. They negate the entire patient presentation of exhaustion, weight gain, cold all the time, and they say that's fine, the lab values look fine. They don't. Another problem is this use of T4 only, or in this case Synthroid. T4 only does nothing. T4 again is like driving along the highway and coming down from 4 lanes to 1 lane and seeing the workmen standing around. There's 10 people there, 9 of them are standing around. The ones standing around are the T4, doing absolutely nothing. The T3, the one that's working, is the active part of your thyroid. You need to know the T3. That's the most important. In this particular patient, her TSH is absolutely normal. 80% of the doctors use just TSH to look at patient's thyroid function. If the TSH looks fine, they say, everything's fine, there's no thyroid problem. But it is a problem. I see 60% of my patients with absolutely normal TSHs have severe thyroid dysfunction. TSH is not a good indicator. Number 2, T4. This patient is on a T4 supplement or Synthroid totally. All they're doing is getting T4. And in fact, her T4 levels look great. They're in the 90th percentile. I suspect in case a physician may say, well, you're getting too much thyroid, we're going to reduce it. The most important thing, though, is to look at the T3. In her case, the T3 is below normal. It's below the 0 percentile. It's below the normal range. So she has T4 in the 90th percentile, and T3, the active functioning part of thyroid, below normal. Now a caveat here is most endocrinologists, most conventional medicine say, oh no, all T4 converts to T3. Look at, in this patient, absolutely not. From the 90th percentile down to below normal. And the reason is stress. Who's under stress these days? Everybody's under stress. That's why Synthroid and T4 alone will not work. You need the combination of this T3 and T4 to provide the benefits, to treat this exhaustion, to treat the problems with weight, to treat the coldness, the clamminess. These are issues that will be modified and corrected when you correct the T3. And that's the goal here. We'll take her T3 with a T3, T4 supplement. We will raise her T3 level up, and we'll see her symptoms will dramatically improve. I see this every single day.